You are welcome to my channel. Thanks for visiting. Please remember to subscribe. Today, let's review together some pieces of information on a medication known as Olopatadine. It's useful as nasal spray, and the brand name we are going to review will be PATANASE, and also as ophthalmic or eye drop as PATADAY. Although we have more than these two brand names. Okay, let's go. Once again, I'm going to limit this review to two uses of olopatadine as nasal spray in the treatment of allergic rhinitis, and that is nasal spray for seasonal allergic rhinitis, also as eye drop to treat pink eye, that is ophthalmic drop for allergic conjunctivitis. Like I've said earlier, we have more than two brand names. It could be generic olopatadine or the following as ophthalmic drops, and could be PATANASE or the following as nasal spray. As per the class, olopatadine is a mast cell stabilizer, a second-generation antihistamine, also a piperidine derivative. Mechanism of action. It inhibits the release of histamine from the mast cells. That is why it is called the mast cell stabilizer. Can be in form of solution for nasal use under the brand name PATANASE or the generic olopatadine, both at 0.6%, or in form of eye drop, that is olopatadine ophthalmic solution, and that could be under the generic name at 0.1%, or the same generic olopatadine 0.2%. And it might be PATANOL or PATADAY, 0.1 or 0.2 or 0.7%. As a matter of fact, the generic is by prescription. Generic ophthalmic drop is by prescription, while the PATADAY is over the counter. Now, administration of olopatadine. First thing first, we will go through the dose. But remember, we have two issues here. Is that we want to use this to deal with seasonal allergic rhinitis. In that case, we'll go for nasal spray, right? And we will go for the brand PATANASE or the generic, that is olopatadine, 0.6%. Then, how? We will check through the age. If the individual before me is between 6 to 11 years, I'm going to use one spray per nursery, twice daily. Okay. If the individual is 12 years and older, then 2 spray per nursery, twice daily will be enough. Then, how am I going to give this? The first thing first, we have to prime the spray, okay? And we'll do that by, shooting 5 sprays into the air, okay? And if you are able to get a fine mist, you may use it. If you have not used your spray for a week or more, then today that you want to use it, let me explain that better again. If you have been on this before, but you've kept it away for more than a week and you want to use it today, you must first of all prime it with 2 sprays. So you're going to shoot 2 sprays into the air. Then you blow your nostrils, clear it of all mucus or any foreign body there. You tilt your head downward insert the applicator into the nostril. The bottle must be upright, and then close your nostril. You take a breath in. Remember to aim the applicator towards the, cheek. Okay. Then you press the pump to release the spray, and you breathe in. With that, you are fine with nasal spray for allergic rhinitis. But if your concern is conjunctivitis, then we have to be careful also, is age specific. Like if you are going to go for Olopatadine, that is generic, 0.1% solution. If the individual is a young person, younger than 3 years, you are going to use only one drop per day. Okay, but if the individual is greater than 3 years, up to the adult age group, you can put one drop in each affected eye twice daily. But the twice daily is not what you would do simultaneously. There must be a gap between the first drop and the second drop, and that will take about 8 hours apart. The honest story here is that the strength of the generic, if it is 0.2% solution, is going to be slightly different from when it is 0.1%. Like 0.2% solution to any child that is 2 years up to adult age group, you can put one drop in each affected eye only once a day. Only once a day. Unlike a 0.1% solution in a child that is 3 years up to the adult age group, when you can put one drop in each affected eye twice a day with 8 hours gap. You can see that there is a difference. When you are using 0.2%, you put one drop in the affected eye once a day. And to the younger age group below 2 years, when it is 0.2% solution, then we have to consider so many other factors. So also, still under the Ophthalmic solution, the over-the-counter brand, that is PATADAY, just read the instruction that you're going to find there, okay? But be careful. It is better you contact your physician or ophthalmologist before you administer this medication anyhow. Then finally on that, when you are using the Ophthalmic solution, if you have contact lens, please take it off, please. Then create a gap. Take the contact lens off, use your drop, create a gap of about 20 minutes up to 30 minutes after you've used the drop before you put your contact lens back. But if you are still dealing with pink eye, it is better you keep your contact lens off for now. Then make sure you are clean, you watch, what goes in the eye. Don't let any dirty stuff come in there. You can, if you think you are not getting enough medication into your eye, then you can repeat the process again, okay? And then we must take one precaution here. Unlike the nasal part, if you think it is cloudy, please don't put it in those eyes. Please don't. And also read the expiration date. If it has expired, no, don't do it. And one thing again that I should not miss out under the nasal spray is that you stop using the nasal spray when you must have used 240 sprays. Now, when it comes to the side effects, it depends on which brand you are using. I mean, is it the nasal spray or the eye drop? Well, if it is nasal spray, well, remember, it's going into the nostrils, right? So there may be ulcer, mucosal ulcer along the nasal orifice, okay? Nasal mucosal ulcer. The individual may feel bitter taste or xerostomia along the path and even upper respiratory tract infection. And it could be a little bit more troublesome in some people that they will come down with nosebleed. Then, if you are using it for eye drop in case of conjunctivitis, you may be battling with blurred vision. Mhm. And you may have feeling of foreign body sensation in your eye. There may be nausea, vomiting, diarrhea, and then also to those who are using the ophthalmic drop, you may be having fear, of light, photophobia. Some will come down with insomnia or even generalized body weakness. A lot of people may have trouble with taste. There may be alteration in their taste sensation, and then some will have runny nose, sore throat, and some other people will have insomnia. Well, in all these, this is not the end to the side effects. So many people can develop so many troubles. There's what you call idiosyncrasy in medicine, meaning some people will react in a different, particular, or peculiar, uncommon way to a particular medication that is different from the way other people in the society will react. So that may be another issue. When it comes to warnings, we will just make sure that we are concerned about the central nervous system involvement in anyone on this medication. And we should also remember that there's likelihood of idiosyncrasy. I've explained that earlier. When it comes to central nervous system, we can advise anyone on this medication not to drive, not to operate any machine that will require alertness. With that, you can become drowsy. Some will become dizzy, right? And some will have headache. It is not expected that it will be sedating because it is not first generation antihistamine, but we need to, like we said, take precaution. When it comes to nasal cavity, we have to watch out for nasal perforation or ulceration and refer appropriately. Remember, if you rewind back to the administration, these medication, either the nasal spray or the ophthalmic eye drop, is age specific. The strength you are using, the age of the patient before us will determine the dose. When it comes to pregnancy or breast milk, well, if you don't have alternative, then use this cautiously. I would rather go for alternative. Drug-drug interaction. Those who are familiar with my channel will know that I will leave that to your pharmacist, your family physician or clinical pharmacologist to determine. Because the list is pretty long, including whether or not you'll be smoking, you'll be taking alcohol, the type of food you are taking, herbal remedies you are taking, other medications that you are taking before or you will be taking after. So I may not be able to go over everything right here. Now, finally, When it comes to monitoring, 2 ways, because now we've been talking about two issues since. For seasonal allergy rhinitis, on account of which you are using the nasal spray, then watch the nasal cavity seriously for ulceration or perforation and refer as it is appropriate. To those who will be on these for pink eye, then it will be better if you think you are not winning within few days that you refer to ophthalmologist for better review and appropriate intervention, because the individual will not thank you after losing his or her eyesight. With that, I've come to the end of this very short presentation on medication that will likely pay less attention to, but really helpful. Thanks for listening. Remember to subscribe again if you haven't, and remember to share this with all your friends. I appreciate it.